Anyway, what we're going to be talking about today, are we started?
Yes.
Okay, we're going to be talking about PICC lines. And the first thing I wanted to go through is flushing PICC lines, okay? Because it seems to be one of those things that we need to be doing first. And if you need to, and Darla, I do have my book there, you can use my book, so you can kind of see what's going on. But one of the first things you want to do, when you come in the room, okay, so you knocked at the door, you're coming in the room, you introduce yourself, and then you're going to be talking to your patient. You're going to ask them whether or not you can go ahead and do this procedure. So you want their permission. You always want to get their permission before you start something like this. If they've given permission, then the next step is I gather my supplies. When I'm gathering, and Sam, come on over here. When I'm gathering supplies, some of the things I need are, if I'm doing the blood draw, I would need, of course, multiple syringes. One syringe for the purposes of the blood, and then a couple for flushing. I'm going to need a tube, whichever tube is appropriate. I'm going to need a couple needles. I cannot use this, and the reason I can't is because you could go in this way, but it doesn't really connect to the system very well. So using that probably is a big no-no. Some of the other equipment that we will be talking about when we assemble supplies for changing the dressing includes things like, these are the caps that we put on the end. These are the impregnated caps that are used for keeping the ends clean. And these are impregnated with solution so they can just be put on. This is a Huber needle, and that's what it looks like. And you can see that it's kind of bent when you look at it, and it has a little guard up here on the top. Okay, and this is a stat lock. The stat lock is used to hold the actual PICC line in place, and it has little clips on either side. Extra alcohol swabs, and if you need one of those little bio tech type, it's actually impregnated to keep the area clean. You have those too, but they come in a little container. Some places use them, some places do not. The dressing itself has a number of features, and we'll get to that when we get to that piece. But that just kind of explains some of the equipment. You'll need 2 masks. You'll also need the disinfecting solution, and you'll need non-sterile as well as sterile gloves. Okay, so when you're cleaning, some of the products that we use you cannot touch with your hands. The product at the hospital is a big no-no for touching it with your hands. These you can touch with your hands, but those, the Sani-Cloths, don't be touching them. You need to put your clean gloves on, at least on one hand. And when you're cleaning your area, clean the entire area, not just part of it. The reason you do that is you want to have the entire top surface ready for receiving clean or sterile objects. So this is what you would do, is actually clean it all the way around like so. Once you've done that, you're done with that disinfecting process. So that's one thing that you would do. Take your glove off, wash your hands again, because you're constantly going to be washing your hands as you're doing this. Then you're going to open up your sterile supplies, get that all ready, have everything that you need in there, but then you're going to remove your dressing. Now, you might want to wait and open this. That's a possibility. Maybe somebody's helping you with it, and they can be opening while you're removing the dressing. There's a couple of different ways it can be done. Probably don't want to leave this open any exceptionally long period of time. If you do not have a kit like this, then you need to get all the items that are in the kit. And as I go through that, you'll see what's going on with that entire kit. So if I were doing a blood draw, I would go ahead and basically have my items available. And incidentally, when you're doing this, you should have everything in the room, or somebody's going to have to run after you, because you really should not leave the room once you get the sterile kit in the room, or get the items in the room. So if I was doing blood draw, and I would put my, and you don't have to do this for a blood draw, but I'm going to show you. The patient, whenever you're doing dressing changes or something, they should have a mask on too. But doing the blood draw, if I was doing that and then doing the dressing change. Now, to do this, you have to first of all flush the line. The line that you're flushing is going to be this one. The red one is the blood draw, okay? It's the furthest one down. Make sure that all the other ones are clamped. And these have the valves on the end, and they also have the impregnated cap. So this is basically what it's going to look like when you go in there. You want to check the site, make sure that there's not any excess bleeding or that there isn't a problem with it coming loose. These are all things you want to do beforehand. Now, Danny, if there's something you come up with that you did extra, for heaven's sakes, let me know. Because every place is a little bit different in what they do. And then when you get ready to do this, you're going to take your syringes like so. These are clean. These are probably going to be clean because my gloves are clean, okay? So because I've cleaned all this, I can lay that on there. And then I would go ahead and remove the impregnated cap, like so. Now I went ahead and put an alcohol swab on the side like that, or your chlorhexidine. This is kind of a nice way if you're by yourself and you've got them all out there and you don't have to try to open them. Have them all ready. You clean. If it's chlorhexidine, how long do we need to clean? 30 seconds. So we're sitting here, row, row, row your boat. And you're doing this probably a couple times. Clean this as much as possible. You know, you want to go about 30 seconds. There's usually clocks in the room. You can watch those. You're cleaning that. And then you're going to flush it. And how you flush, you insert, unclamp, and then when you flush, you start it and kind of use this kind of motion. Incidentally, one other thing I wanted to mention to you is that you remove the air from the system so that you're not putting air into it. I'll show you with the next one. Okay, so that's one. Would someone please hand me the next one? Now, if it was one of those things where you were started, you'd have to do that. Thank you. This one comes out of my system. Pull back, push up. And so then I go ahead and I flush. Now once I've flushed, I have to pull back and I want to try to get as much as I put in. Now I know my glove's not going to work that I have in there, but anyway. So if you put 10 or put 20 in, how much do you have to pull out? 20. Okay, so you pull out your first 20. You put your next syringe on, and let's say if I touch the end, I've got to clean again. And let's say my 30 seconds have passed. And I pull back, and I'm pulling back my next 20. Now, once I've done that, I discard it. So then this gets discarded. When I'm ready to do my actual blood draw, clean again. And how long?
30 seconds.
And then I start pulling back. pull back the amount that I want. And then I'm going to need another syringe. And I'm going to have to flush. Thank you. Well, this one I can use also if I need more blood. I'm just going to clean, pull back, and let's say I need 20. Now this is ready to go into the blood into the tube. You have to do this fairly fast. At this point, I clean, I get a new cap, and let's say this is my new cap. Put a new cap on, like so. And then I would take this, and this is just clean, so I take this, try not to touch the end as I did.
And you reflushed it after the blood draw?
Mm-hmm.
Okay.
You reflush after the blood draw. And then this goes in like so. And that's my blood. So let's say that goes in. Yes, and let me show you that, because I'm glad you pointed that out, Sam. Say this is my old top. Clean, clean, clean. And then I flush. I make sure that it's completely flushed. And using a pulsating motion, and see, this would have had no air in it. I do not want air in the line. That's what I'm looking at. I do not want air. I want solution. Sometimes, though, it will be a situation where they're using heparin. Danny, do they use heparin? Heparinize these?
If they're included, I guess, but I would use the doctor's one, phase, something like that. It's called, it's like a blood busting.
Clot
Phase.
activase.
Phase.
Activase.
Yeah.
Okay, some of them will use just saline. Some of them will use heparin. Depending upon what is being done, you want to go ahead and use whatever solution. So this would be a separate one that you're going to heparinize, or you're going to use saline, or whatever needs to be done. You do just as much or a lot with the pulsation. You want a pulsating movement because it actually does help with that process. So let's run through this one more time. How do we do this? You come in the room, you introduce yourself, you ask permission, you've washed your hands. Then you go ahead and you would assemble your equipment. You have everything there that you need to assemble with. With the blood draw, I need the tubes, the correct orange top, green top, whatever size tube I need. I have to get those type. I need at least a couple syringes, don't I? You're going to remove the air from the syringes. I've cleaned the top. How long do I clean? 30 seconds with chlorhexidine. Okay, so once I've cleaned, then I'm going to flush with how much?
20 mils.
Probably 20 mils divided into 2 tens. Okay, so I've done that. I go ahead and I flush. And I flush and I use a little pulsating motion. Make sure that it's open. Then I clamp my tube, remove that, and then I'm ready to pull back. And I probably could use a 20 mil to pull back my solution or my blood. Once I've done that, then I have to clear it with, let's say, heparin or saline or whatever else. Does that make sense? Okay. Have I missed anything? Look at your procedures and make sure I haven't missed anything. Yes, Danny.
So I heard that if you use a smaller syringe, it's not a good thing. So you usually use the 10. But if I use bigger, will that affect? Like if I use
you really want to use, this actually gives you about the right pressure, PSI pressure on the inside of the actual PICC. So you want to use something that's like this, okay? Oh, one other thing. Do I have air in this when I push it in?
No.
No, air does not. You do not want air in that, okay?
So anytime you take a syringe off, you clamp it, correct?
You should be clamping, and you should be, here again, cleaning is probably a good thing to do in between.
So clean and clamp it between every syringe,
Mhm,
like
I would.
every flush and then.
Yep. Now, I'm probably having you do more cleaning than you need to, but there's, you know, I would rather you do more cleaning than not enough. Danny, did you have another question?
Do you know if there is any test that I cannot, I guess that, I cannot use that site to get blood from?
There are times, Danny, that these become plugged, and I have seen people or heard of people using the other ones.
Yeah.
But this is the one that's supposed to be used for blood draw.
Cultures.
Any, like,
Blood cultures, if they're
Well-
culturing that, then you do, but if it's a blood culture where they want one in the left and one in the right, then you have to draw. You can't just
From the
draw,
very-
Separate,
yeah, that's the
Yeah.
Draw
only
separate.
test that I know of that,
okay.
yes,
she might know more, I don't know, I don't know
Yes.
if that's fixed.
There's differences for different places, facilities. What I found is what I do at Blessing may not be the same thing I do at Hannibal Regional. And every patient's different because the doctor may have different orders. For example, when we're done, some of them are heparinized. You want to ask that question before you even get started. Am I heparinizing this afterwards? These are all things that we do. And if they say, well, this is what we do as part of our policy, some patients may not be good candidates for heparinization if they're on already clot busters and things like that, and they're bleeding and bruising. When you see a lot of bleeding and bruising on your patient, it's probably not a good time to consider using heparin again. You know, you have to be careful about the use of it. It's a drug like everything else. Is there anything else I've missed on this?
The only thing that I see that's different is it says to, flush with 5 to 10, and we're saying 20, but that might just be a
The
The
policy.
10 in between, you can use as much as 20,
Okay.
and that's in between, or at the beginning. You can use 10, you can use 20.
Yeah, this one just said 5 to 10, so I didn't know
Yeah.
if maybe it had changed since then, I just wanna do what's.
Policies, well, and I don't have a problem, I would always use probably a 10 mil
Yeah,
in between. Because to be quite honest, and this is something that Dr. Moss has also mentioned to me, you know, she's seen as much as 2 of these.
right.
She's a peritoneal dialysis, or she's a dialysis nurse. You know, they do a lot of flushing. And she suggested both.
See, and that's what I thought we did last when we did the check off, cause you flush the one, and then you flush the 2, and then they would pull it directly back into that second one.
You can
waste
pull it,
and
and yes, you can pull it back into the second one.
then waste
And then
that.
you've got the other one, yeah, and then you've got the other one that you can actually use for your blood draw. You know, that's a possibility, but you also need to know how much.
And if the hospital says that one, that's okay, their policy might be different.
Yes, that's true, that's true. But I believe I do have the Hannibal Regional policy in there as well. Okay, and I'm trying to teach you something that will be, I personally believe too much cleaning is not enough. You can clean after every one of these. I don't want somebody getting something through those lines. Okay, so once you're done, you flushed all the blood out, you've cleaned that all out, and you would have done this when you're flushing all these lines. You would take a saline flush the line, you're going to clamp, and you're going to remove the caps. And this cap is actually the kind that can be removed, if I can remove it. Clamp, remove the cap like so, and then you can put a new one of these on. They come separately. All these little pieces come separately. Okay, so, and what, incidentally, when I remove that, I'm cleaning before I put the new one on.
One
Yes.
time I couldn't get the cap off, so what do? It was,
Do you have a
I just passed it
hemostat
on.
with
Huh?
you? Do you have a hemostat with you?
when I could get one, I guess.
Okay, the other thing is, sometimes I think it's a good idea to have a hemostat. So I would have cleaned, put my new cap on, I had that already, had my new impregnated cap, I put those back on. And these need to be changed periodically, so that may be a situation where, I think it's like in some places it's every 12 hours. Some places may be more than that, depends on how it's used. If I saw blood in this, I need to change it. Okay, so this is one of those things, when you're looking at this, look at these tubings, look at that dressing, make sure that there's nothing there that could indicate that maybe I need to change dressing. And one other thing I want to emphasize, when you go in the room, check to make sure these are clamped. There has been times I've walked in the room and I've seen air bubbles in them. And that's not good. So you've got to get that out. So you're going to pull back and then push fluid into it. I would not push air bubbles in. Okay? And I think you know that, but just be aware that they are clamped. Sometimes they can be all the way clamped and they'll still have air bubbles in them. Somehow there's some siphoning that's occurring. Something's going on with the PICC line, and it might be compromised. So the moral of the story is, when you run, look at your IV lines, look at your PICC line. Questions? Yes, Danny?
One more thing. If the other terminal breaks, what would it do?
Are you talking about this area?
Yeah.
If this, let's say it's broke,
Yeah.
or they don't have this on,
Yeah, if let's say you try to, let's say, open it and it breaks or something like that.
oh, you mean the line breaks?
Yes.
Well, you want to clamp it first, if at all possible. Get it clamped as quickly as possible. I wouldn't use a hemostat on the tubing because you can tear up the tubing. But, you know, if you're using it to remove this, that might help you get it off. I've had them before that I cannot get them off.
Yeah.
They are just on there, it seems like, permanently. But you need to check with your staff and the policies to determine how often these are supposed to be changed. Yes?
So I just wanna make sure I'm understanding. Are we coming in and just messing with the one that we do blood draws from? The
Yes.
single one?
But I want you to verbalize what you're going to do for the other ones, okay? I'm not gonna have you flush everything,
Okay.
but I want you to demonstrate the flushing procedure, okay? At least 10, you know, when you're doing it. Sometimes you may have to flush with 20, depending upon the situation. If
So
it's running real sluggishly, that's probably when I'd use the extra 10.
So like, we could do like, come in with the 2 10 mils and like flush one whole 10 mil and then maybe take the second one and flush like 5 into it, then we could pull back our blood with that one to waste that one. Would that work?
You'd still have to pull back 15,
Okay.
okay? You could pull back with the 5, and then pull it back with the other one, the 10.
So we would still need that empty syringe to do the rest of the 10 with?
Yes,
Okay.
yes, you would. Does that make sense? Okay, so what you put in, you gotta take out before you can get your blood draw. Okay, is that it? So that concludes the blood, or getting blood from the tube.